Good morning. I'm going to present the topic on colorectal cancer in Mozambique. The contents will be these. The title of the study I did in Mozambique is Demographic, Clinical, and Pathological Characterization of Patients with Colorectal and Anal Cancer, followed between 2013 and 2016 at Maputo Central Hospital in Mozambique. In terms of demographics of Mozambique, I should say that Mozambique is located in the southeast of the African continent with a population of 30 million, according to World Bank, and with a surface of 799,380 square kilometers with a population density of 36.1 inhabitants per square kilometer. This table shows you that the life expectancy has increased, as you can see, from 2007 to 2017, which would explain why the oncological diseases are increasing. And the purpose of this study was to investigate the colorectal cancer data and anal cancer data from Maputo Central Hospital, which is the largest hospital and the reference for oncological diseases in Mozambique, with the aim of characterizing the disease profile in view to define an appropriate control program. The results we found in this study, which is actually similar to what we already know around the world, is that the female gender was more prevalent, even when anal cancers were excluded, the median age of 54 years, and most patients in this case lived in Maputo city. The most common presenting symptom was rectal bleeding, with the most frequent histological type being adenocarcinoma, and the rectum was found to be the most prevalent anatomical site. The most cases of colorectal cancer were found in advanced stages, which is why the colostomy was the most frequent surgical procedure. And most cases of anal cancer occurred in HIV patients, and actually most patients had a poor prognosis. And what is known about this topic? We already know that colorectal cancer is already the third leading cause of cancer-related death in the world, and its incidence is steadily rising in developing nations. The age standardized incidence rate in low human development index nations is higher in men than in women. And anal cancer is clearer on the rise in sub-Saharan Africa. And what this study adds to what we already know. This study is the first study describing the patients with characteristics in colorectal cancer and anal cancers in Mozambique. And most cases in this study were diagnosed in advanced stage, to whom palliative care was the only possible treatment. And the adenocarcinoma was the most frequent histological types, and the most prevalent anatomical site was the rectum, and being the cancer of the anus, most frequent in HIV patients. In conclusion, I would say that we see a clear increase in case of colorectal cancer and anal cancer in Mozambique, and much needs to be done for prevention, like earlier diagnosis and improvement of survival. And we think that the comprehensive public health program is needed, as well as appropriate diagnostic and therapeutic resources allocation in quaternary hospitals dedicated to this pathology required within Mozambican health system. Thank you very much.